Peace and assalamu alaikum. Assalamu alaikum. Come on in. We got a major update on this whole coronavirus situation. I just wanted to share this important document that was given to me. And if you want a copy of this 4-page document, y'all gonna have to leave your email in the comment section. Peace to you, brother Gorilla Black. Peace to you, brother. Major update, from a scientist, from UCSF, okay, the University College of San Francisco, okay, and I'm going to read this panel discussion on the coronavirus that is very important. Okay, I want people to really take this situation seriously, because there are a lot of people who said, we black, that ain't black people problems, and they got the means to basically say, black people can't get the coronavirus, right? So I just want to present the information to you, whether if you would agree with it or not, whether if you think it's a conspiracy or not, that's not why I'm doing this. I'm just putting out the information. Wa alaikum salam, brother. I am Saudeen. I'm just putting out the information, and you operate how you choose to operate because you're an adult. If you're in the Nation of Islam, we already received our instructions. But I wanted to read this very important document that I got from a source who's very close with this scientist, right? And I'm going to read his credentials. Okay, I'm going to share my screen with y'all. I'm sorry about that. Share my screen with y'all. Okay. All right. This is from the University of California, San Francisco BioHub panel on COVID-19, March 10th, 2020. Right, there was a panel discussion with major scientists. So I'm going to read the scientists' credentials. Panelists or scientists by the name of Joe DeRisi, UCSF, University of California, San Francisco, top infectious disease researcher, right? He's a top infectious disease researcher, co-president of Chan Zuckerberg BioHub, a JV involving UCSF, Berkeley, Stanford. He's also the co-inventor of the chip used in the SARS epidemic. Okay? He's the co-inventor of the chip used in the SARS epidemic, right? Emily Crawford, COVID task force director, focused on diagnostics. Christina Tato, rapid response director, immunologist. Patrick Askew, leading outbreak response and surveillance, epidemiologist, and Chaz Langlier, UCSF infectious disease doctor, right? These are some official people. We ain't talking about people putting together any memes or nothing like that. We ain't talking about conspiracy theorists. We talking about people in the field of infectious disease, okay? I'm going to read to y'all some of the stuff they said. They said, I'm going to read, it says, what's below are essentially direct quotes from the panelists. I bracketed the few things that are not quotes. Top takeaways from this conversation. At this point, we are past containment. Containment is basically futile, right? So we are past the point of containment, y'all. It says, our containment efforts won't reduce the number who will get infected in the US. Now we're just trying to slow the spread to help healthcare providers deal with the demand peak. In other words, the goal of containment is to flatten the curve to lower the peak of the surge of demand that will hit healthcare providers, and to buy time in hopes a drug can be developed. So we are past the point of containment, and they're trying to slow it down as much as possible, right? But that's not it, though. Some more interesting stuff. How many in the community already have the virus? No one knows. We are moving from containment to care. We in the US are currently where Italy was a week ago. We see nothing to say we will be substantially different. 40 to 70% of the US population will be infected over the next 12 to 18 months. That's a large number. From 40 to 70% of the US population will be infected over the next 12 months. After that level, you can start to get herd immunity. Unlike flu, this is entirely novel to humans. So there is no latent immunity in the global population, right? There's no immunity within the global population, right? It says in the parentheses, we use their numbers to work out a guesstimate of deaths, indicating about 1.5 million Americans may die. The panelists did not disagree with our estimate. This compares to seasonal flus average of 50,000 Americans per year. Assume 50% of US population. That's 160 million people infected. So this scientist guesstimated that there will be 160 million people in the United States of America infected. With 1% mortality rate, that's 1.6 million Americans die over the next 12 to 18 months. 1.6 million Americans, they believe, will die from over the next 12 to 18 months. The fatality rate is in the range of 10 times the flu. This assumes no drug is found effective and made available. The death rate varies huge by age. Over age 80, the mortality rate could be 10 to 15%, right? And it says, see the chart by age 6, sign found online attached at the bottom. Okay. Don't know whether COVID-19 is seasonal, but if it is and subsides over the summer, it is likely to roar back and fall as the 1918 flu did. I can only tell you two things definitely. Definitely it's going to get worse before it gets better. And we'll be dealing with this for the next year at least. Our lives are going to look different for the next year. What should we do? What are you doing for your family? Right? And it has three more pages of it. You know, so I'm not going to read the whole thing today. I'm not going to read the whole thing today. I just wanted to give an update that this is a real life situation. We can't take it for granted. It has a lot of information in here, y'all. It has a lot of information here. I'm not gonna read it all today, but I just wanted to give y'all an update that scientists believe that it's going to be up to 160 million people. From 40 to 70% of Americans will get this virus, right? And they also believe that they will be susceptible to getting it after getting rid of it, getting it again, right? So You know, we want to just take caution and protective measures on protecting ourselves. Brother said, "Let me into chat." Brother wanna jump on? Want me to send you the link? Want me to put the link in the chat? Is that what you asking? If that's what you asking, let me know. Brother said the FOI training manual has a lot of items we should get ASAP other than food items. Now, I agree. Okay, I'm gonna put the link in the chat. If you wanna jump in, if you wanna jump on the panel. But again, I'm letting y'all know that this is not a drill. This is the real thing, you know, and I just feel like, you know, the American government should have known better than to allow those Americans who are in China to come back, you know, to America. You know, hold on one second, family. Peace.
Greetings, brother. Greetings.
Peace,
How
brother.
you doing, man?
All right, how you doing, sir?
Good, good, man. We had a pretty good discussion the other day, man. I just want to let everybody know. Well, you know, they've been talking about this thing for a while, you know, this situation that they're trying to create. You know, they're trying to create a new world order, a one world government. And if you notice, they have all the different governments working together, trying to, as they would say, come up with a cure for this flu pandemic.
Right.
And I just believe that when the smoke is cleared, since they're making such a big deal of it, our lives aren't going to be the same before this thing happened. Okay.
Right.
I'm thinking that
I don't know, is the brother still there? Brother might have to go out and come back in because the brother froze. But let me know if y'all can still see me, if y'all can hear me. I thought about that too. Brother Books for Moses made a great comment. He said, I think there's some kind of vaccine push, just my 2 cents. I thought about the same thing too. Brother may have to go out and come back in. Because hold on. Okay, yeah, are we live? Because YouTube rejected my comment, said this usually means they think it's a spam. Try changing it a bit. What? We live, right? I don't know why YouTube will reject my comment and I'm the host, right? And you know, it's crazy because there was another part about kids in school, right? Let me show it. I'm gonna read it. Matter of fact, I'm gonna share my screen with y'all again. I'm gonna read it. I'm gonna read it to y'all. it was a part where they was talking about kids at school and stuff. Okay, I think I found it. Okay, I think it says, I think this is it. Okay, it says, how well is society preparing for the impact? Local hospitals are adding capacity as we speak. UCSF's Parnassus campus has erected triage tents in the parking lot. They have converted a ward to negative pressure, which is needed to contain the virus. They are considering reopening the shuttered Mount Zion facility. If COVID-19 affected children, then we would be seeing mass departures of families from cities. But thankfully now we know that kids are not affected. School closures are one of the biggest societal impacts. We need to, and you know, it's crazy because in California, especially in LA and the Moreno Valley areas and Riverside, you know, they shut down the schools for children. You know, my sons and them, you know, they schools are shut down. They said they're going to be out at least 2 weeks of school. And it says we need to be thoughtful before we close schools, especially elementary schools, because of the knock-on effects. If elementary kids are not in school, then some hospital staff can't come to work, which decreases hospital capacity at a time of surging demand for hospital services. Public health systems are prepared to deal with short-term outbreaks that last for weeks, like an outbreak of meningitis. They do not have the capacity to sustain for outbreaks that last for months. Other solutions will have to be found. What will we do to handle behavior changes that can last for months? Many employees will need to make accommodations for elderly parents and those with underlying conditions and immune suppressed. Kids home due to school closures. Okay, yeah. So yeah, in California, they shutting schools down right now. Yeah, they shutting schools down. So, you know, so I don't want people thinking that this is not serious. This is real. This is not a game, man. You know, this is what I'm showing is from a scientist. So if you want, you can email me at malcolmflex19@gmail.com. You can email me at malcolmflex19@gmail.com, and I will forward this 4-page document. I'm going to post it in the chat. So y'all can email me and I'll send it to y'all, but this is real, man. They think they're saying that they believe that it's going to be up to 160 million Americans who will get this virus. And they don't have any cures or any vaccines for it right now. They testing and everybody's trying to find a cure and things to get rid of it. But right now we are past the point of containment. Okay, we are past the point of containment. Okay, so I just want to do this quick video. I'm gonna come back and with another video in probably about 30 minutes to an hour, because brother Ben did a wonderful video, man. I just wanted to follow up on that if I could. So yeah, man, it's your brother Malcolm Flex TV, man. I didn't want to be long. I just wanted to just give y'all that information. And if you missed it, family, go back and watch it from the beginning. And I'll and if you want the 4-page document from Dr. Joe DeRisi, okay, I'll send it to you via email. All right. Assalamu alaikum.